Cervical cancer is a malignant tumor deriving from cells of the cervix.
What is the cervix? The cervix is from the lower part of the uterus, which is the womb, connecting to the vagina, which is the birth canal.
The cervix is comprised of two cell types, the squamous cell type and the glandular cell type.
Cervical cancer tends to occur when the two cell types meet. This is called the transformation zone.
Cervical cancer is the fourth most common cancer in women in the world, and it has a higher incidence and mortality rate in lower middle income countries, which accounts for 90% of all cervical cancer deaths. Why is this so? This is due to the lower access or reduced access to vaccination, screening, and treatment in these areas. Also, HIV patients are 6 times more prone to cervical cancer than the general public. 5% of cervical cancer patients have HIV.
Human papillomavirus is epitheliotrophic and it plays an important role in development of cervical cancer. HPV infectious cells called chondrocytes are enlarged cells with perinuclear halo. Their nucleuses are large, irregular, and hyperchromatic. Now, these HPV cells have high oncogenic risk and low oncogenic risk. The cells with high oncogenic risk are 16, 18, 31, 33, 45, and 56. And those with low oncogenic risk are 6, 11, 42, and 43.
Risk factors of cervical cancer: smoking, unprotected sex, weakened immune system, several pregnancies, giving birth at an early age, family history, long-term use of contraceptive pills.
So the clinical features of cervical cancer: you can have abnormal vaginal bleeding. This will occur after a sexual intercourse in between your periods or postmenopausal bleeding. You can also have foul-smelling vaginal discharge. You can also have pelvic pain, weight loss, and painful sexual intercourse.
How do we prevent cervical cancer? We do this by identifying a high-risk female first. Now, who is a high-risk female? A high-risk female is someone who's had multiple sexual partners, started pregnancy at an early age, has had multiple births, and also started sexual intercourse at an early age. Someone who is of low socioeconomic status and someone who has poor maintenance hygiene. Now, how do we help this female? We do this by giving a prophylactic HPV vaccine. We can also achieve prevention by using a condom during sexual intercourse, abstaining from premarital sex, and also family planning, and also by making sure that our younger females don't get into marriage at an early age.
Routine screening and testing for cervical abnormalities can help detect early-stage cancer and precancerous conditions that can lead to invasive diagnosis. These tests include pap smear tests, an HPV DNA test, colposcopy, cone biopsy, and other tests include CT scan, MRI scan, and a chest X-ray.
Other conditions that could present like cervical cancer include cervical ectopy, cervical tuberculosis, fibroid polyp, STI, endometriosis, syphilitic ulcer, and parts of a baby in an incomplete abortion.
The cervical screening test is going to be a VIE test whereby the healthcare professional is going to be able to apply acetic acid to the cervix to be able to visually inspect it. So we encourage every Babcock University female student to be able to come to Babcock University Teaching Hospital to be able to carry out this test. It's not meant to be invasive, and this is going to be very simple. So all you need to do is to be ready for this particular day, 25th of February, and as you do so, let every other person be aware of this so that we can, at least from our environment, be able to prevent cervical cancer in the nearest future. Thank you.
We as medical students and members of this great association have come together to create awareness and screening exercises to reduce the burden of cervical cancer in our immediate communities, as we, as doctors, want to be the change that we want to see.
Yeah, we'll be at the Kenya communities on the 25th of February 2024 to make this plan a reality. So please come out, support us, and join us, and let's eradicate cervical cancer once and for all. Thank you.
Cervical cancer, together we can fight it.